welcome back. Poor oral health practices not only affect your dental hygiene, but can lead to a wide array of general health illnesses. Illnesses such as cardiovascular disease, diabetes, arthritis, and even cancer. Tonight we look at obstructive sleep apnea and how this condition can affect your dental or oral health. Obstructive sleep apnea, also OSA, is characterized by episodes of complete collapse of the airway or partial collapse with an associated decrease in oxygen saturation or arousal from sleep. This disturbance results in fragmented, non-restorative sleep. Our general practitioner, Dr. Nelson Makemba, now joins us to tell us more. Doctor, good evening and thank you for being here.
Good evening to you, Nina, and good evening to our viewers this evening. My name is Dr. Nelson Makemba and I'm a general practitioner. I'm glad to be here to be talking to you tonight.
Thank you so much. It's interesting how, of course, they say that your mouth is the gateway to the rest of your body. So yeah. I think it's quite apt, of course, if you don't look after that there are multiple illnesses that can come from that. Yeah. Let's start with drawing correlation between poor oral health and OSA, or rather how OSA can also affect your oral health.
Yeah, individuals that suffer from obstructive sleep apnea, as you have alluded to in your introduction, because of that oxygen delivery that has been compromised. What tend to happen is, by far, at night when they are asleep, they often open their mouth and try to breathe also through the mouth to compensate for that decrease in oxygen saturation, and that tend to dry up their mouth a little bit. And when your mouth is a bit dry, then you are predisposed to getting oral decays, like dental decays. You might end up with gums disease and oral cavity compromise, and that compromises your health. And that's really the correlation that exists between obstructive sleep apnea and then that oral problems that can result from that dry mouth that you do experience.
I understand that individuals who suffer from OSA also sometimes excessively grind their teeth. Is that right?
Definitely, they do that as well. Yeah. And that also then can lead to further complications as well.
What causes the obstruction that happens in sleep apnea?
There are a few things that tend to happen. First and foremost, for instance, if somebody is excessively overweight, the neck tend to be short, and it's, because of the overweight, what tend to happen is when the individual is asleep, the muscles relax, so as they are breathing in and out, the airway is narrowed some bit, and that can really affect them when they are asleep, and they can develop an obstructive sleep apnea. If somebody is having adenoids or recurrent tonsils that get inflamed, that too can obstruct the airway and then predisposes them to ending up with obstructive sleep apnea. Or just a nose that is constantly congested as well. Individual that smoke, individual with asthma. And if you do come from a background where your family has, a sleep apnea-related problem, obstructive sleep apnea-related problem, you might also be a candidate to that as well.
Hereditary as well.
Yeah, there can be a genetic predisposition as well. And we do see it also in individuals that are hypertensive. For some reason, they can also develop an obstructive sleep apnea. But just to mention a few.
Sure. How do I know that I suffer from this? What are the symptoms that I'd look out for, except for waking up with a dry mouth in the mornings?
Yeah, you do wake up with a dry mouth and a dry throat. In the morning, you might have morning headaches. The individual that has obstructive sleep apnea, they snore quite a bit. Because you're not sleeping restfully, you might have this, constantly tired. You might, feel sleepy during the day. That obviously can then affect your productivity at work and so forth in schools with children as well. Yeah, that kind of presentation, your mood might change because you're not sleeping properly. You might become irritable, depressed. That kind of presentation tend to happen. And obviously you tie that in with, maybe the person being a bit obese, or they've got tonsillitis or tonsil problems, adenoid problems, and then you probably are safely to say that there could be a problem of an obstructive sleep apnea going on.
Yeah. How serious is obstructive sleep apnea, Dr. Makemba?
It can be very serious. Let's start off with children, for instance. Remember, when a child is growing, the brain is still maturing. And if a child has obstructive sleep apnea, for instance, the brain doesn't get sufficient oxygen, particularly at night. That might hinder, brain maturity, and it might later in life affect their cognitive function. And then, in an adult population, if you're not sleeping well at night, obviously you don't get to be, fresh in the morning, so you might not be productive in your work environment. children struggle at school, for instance, that have sleep apnea, the teacher now complains to the parents that the child is not focusing, the child is sleepy all the time. There can also be cardiovascular complications, particularly with your heart as well. And then we also know that individuals that have obstructive sleep apnea, for instance, in adult population, they might have decreased libido, and that can also affect, their sexual, function and the quality of their life as well. So these are the kind of things that can happen. And from our side as doctors, if an individual has obstructive sleep apnea, for instance, and they have to go in for a surgery, and then general anesthesia has to be administered, there can be complications that might arise as well once they are under general anesthesia. So these are some of the stuff that we tend to commonly see happening with these individuals.
Just finally, doctor, how do you cure this?
Probably by far curable is not the terminology we might want to use, but we can reverse the incidence of the apnea by modifying, some aspects surrounding the individual in question, lifestyle modification, losing weight, exercising, stopping smoking, for instance. Those that have recurrent tonsillitis, they might have them removed, or adenoid can be removed. And when one sort of incorporate this kind of, lifestyle modification, that intensity, that or the obstruction that happens at night when you are asleep might just go away. And then we also advocate that individual sleeps on the side instead of sleeping rather prone with your face down or on your bed. When you sleep on the side, sometimes you're able to pull in as much air when you are asleep, and it may not necessarily disturb your sleep, and you might actually do better that way.
Dr. Makemba, thank you so much for being here this evening.
It's
always lovely having you with us.
Thank you very much. Thank you very much. It's always a pleasure being here.
That was Dr. Nelson Makemba speaking to us. When we come back, it's time for